Jaundice. What is jaundice? Jaundice may be defined as yellow discoloration of the skin, sclera, and mucous membrane due to an increased bilirubin concentration in the body fluid above normal. Normal serum bilirubin is 0.3 to 1 mg per deciliter, and clinical jaundice occurs when bilirubin in plasma exceeds 3 mg per deciliter. Symptoms of jaundice. Prodromal features such as nausea, vomiting, and anorexia is seen in viral hepatitis. Itching precedes jaundice in obstructive jaundice. Abdominal pain suggests the presence of stone and cholangitis. Weight loss occurs in chronic liver disease and malignancy. Dark urine and pale stool is seen in obstructive jaundice. Fever plus rigors may be present, and dry eyes or dry mouth and fatigue may be present. Recent drug history can be found, and other symptoms are exposure to intravenous drug or blood transfusion, which may cause hemolytic anemia, hepatitis B virus, and hepatitis C virus. Travel history and country of birth may be present, and we have to take the history of residence. Either the patient has came from malaria or Kala-Azar endemic zone. Then past history of jaundice should be taken. Then metabolic syndrome such as increased BMI and type 2 diabetes mellitus or hypertension should be assessed. Autoimmune disease history, alcohol history, inflammatory bowel disease, family history of liver disease, autoimmune disease, or the metabolic syndrome, and history of sexual exposure for hepatitis B virus and hepatitis C virus should be assessed. Family history of Wilson's disease, polycystic liver disease, etc., and bleeding from any site of the body should be assessed. Then a clinical examination is done. In general examination, we look for the appearance which shows hepatic facies. Then consciousness level decreases in hepatic encephalopathy. Then anemia, jaundice may be present. Clubbing is present in primary biliary cirrhosis. Palmar erythema is present in chronic liver disease. Flapping tremor is the sign of liver failure. Pulse and BP is checked to assess hemodynamic status. Temperature, edema, spider nevi, lymph nodes is assessed. Then hair distribution is seen because there is loss of hair in chronic liver disease. Gynecomastia is also seen in chronic liver disease. Systemic examinations are done to assess if ascites, hepatomegaly, splenomegaly is present, or any abdominal mass, or any features of chronic congestive cardiac failure, and any feature of neurological deficit, example in Wilson's disease, is present or not. Investigations are done to see liver function tests. We check the serum bilirubin concentration, serum albumin concentration, and we check for enzymatic functions such as ALT or SGPT, AST or SGOT, alkaline phosphate ALP, gamma glutamyl transferase, and we also see prothrombin time. Then we do other tests such as viral markers. Then total plasma protein level is checked. Urine is analyzed for bilirubin and urobilinogen. Routine hematological tests, serum, electrolyte and urea level is checked. Then radiological imaging such as ultrasound, CT scan and MRI and cholangiography is done. Seroplasmin level is checked. Then liver biopsy is done for histology. Endoscopy of upper gastrointestinal tract is done to see esophageal if esophageal varices due to portal hypertension is present or not. Then genetic analysis is done. What are the causes of obstructive jaundice? The causes are intrahepatic cholestasis occurs due to primary biliary cirrhosis, then primary sclerosing cholangitis, alcohol, drugs, cystic fibrosis, severe bacterial infection, hepatic infiltration such as lymphoma, granuloma, amyloidosis and metastasis, then pregnancy, chronic right heart failure, inherited cholestatic liver disease such as benign recurrent intrahepatic cholestasis. They all can cause intrahepatic cholestasis. And extrahepatic cholestasis can occur due to following reasons such as for carcinoma, which may be ampullary, pancreatic, bile duct or due to liver metastasis. Then choledocholithiasis, parasitic infection, traumatic biliary stricture and chronic pancreatitis. The clinical features of obstructive jaundice are: the early features are jaundice, dark urine, and pale stools and pruritus. The late features are malabsorption like vitamin A, D, E, K. It causes weight loss, steatorrhea, osteomalacia, bleeding tendency, and xanthelasma and xanthomas are also seen. Features of cholangitis are fever, rigors, and pain if gallstones are present.